America has a nursing shortage. Millions felt the pain of that shortage during the pandemic.
We're facing an estimated shortage of 10,000 nurses over the next 5 years.
See a shortage of nearly 30,000 registered nurses by 2025.
Every patient seems to say, oh, we need more doctors, we need more nurses.
Across America, a silent crisis is unfolding. Hospitals struggle to keep up with patient demand, and rural communities are left without enough doctors and nurses. This is the reality of healthcare workforce shortage, a growing problem that affects millions.
Tracy's been a nurse for 17 years, but as pressure mounts, she's considering a job at a cafe.
With millions of Americans facing challenges in accessing quality care, it is critical to explore the underlying causes of these shortages and the consequences they have on both healthcare workers and patients. Many of the factors that are contributing to the shortage are detrimental and will require solutions to help curb the crisis. An aging population, burnout among healthcare workers, and not enough educational resources will only continue to worsen the effects of the shortage. This video will argue that addressing the healthcare workforce shortages will require a collaborative strategy by further elaborating more on the possible causes, history of the shortages, the impact on society, and the proposed solutions. A number of important factors have contributed to the healthcare workforce crisis. One of the main causes of this is the aging population. The U.S. Census Bureau predicts that by 2060, the number of Americans 65 and older will have nearly doubled, dramatically increasing the need for healthcare services. Burnout among healthcare workers has also worsened in the recent years, especially following the COVID-19 pandemic. More doctors reported experiencing burnout, highlighting the toll that long hours and high stress take on healthcare workers. In addition, limited educational opportunities worsen the crisis. Medical schools and nursing programs struggle with insufficient spots and funding, which prevents many from entering the field. These combined factors create a system under strain, unable to keep up with the needs of the population. The healthcare job shortage is not a recent issue, but is one that has evolved over decades due to various policy, economic, and global factors. In the early 20th century, nursing began to gain recognition, but World War I and World War II drained hospitals of nurses and physicians, creating a critical shortage. After World War II, the demand for healthcare surged due to advancements in medical technologies, yet there weren't enough trained workers to meet this need. In the 1980s, another shortage occurred due to a sharp decline in nursing school enrollment, driven by cultural shifts and financial barriers. To combat the shortage, a number of policies have been introduced, such as the Nurse Reinvestment Act of 2002, which aimed to improve nursing education by forgiving loans and offering scholarships.
Being short in staff makes it harder to provide the best care for our geriatric patients. With fewer nurses, we have to see more patients in less time, which means appointments can feel rushed, since elderly patients often need extra attention for their complex health issues. It's harder to give them the personalized care that they deserve.
This highlights how the healthcare job shortage is having a significant impact on businesses and clinics. With fewer healthcare workers available, clinics and hospitals struggle to meet patient demand, resulting in longer wait times for appointments, procedures, and overall medical care.
I would describe the staffing nursing situation as critical. There are not enough nurses to meet the growing demands in hospitals, clinics, and long-term facilities. Burnout is one of the leading factors driving nurses away from the field. Low staffing levels affect the workload for nurses on a daily basis because it results in nurses having to cover more patients than is safe or effective.
Due to this shortage, healthcare workers have to work so much harder and make sure that all the patients are satisfied with their care along with it. But this can also cause healthcare staff to get exhausted from having to overwork and can cause mistakes to be made, which affects the patients and the treatment they end up receiving. By supporting healthcare workers in their studies through things like offering scholarships and starting more training programs, it would attract more people interested in the healthcare profession that don't have money required to study for it. The issue of shortages in the healthcare workforce is intricate and complex, having developed over several decades as a result of numerous historical, social, and economical causes. From the impacts of major wars to the changes in education systems, along with the recent challenges posed by the pandemic that have further exposed the fragility of the healthcare system, it is clear that these shortages will continue to threaten the access to healthcare and quality of care for patients across the country. Understanding the root causes is essential for developing effective solutions. Therefore, an approach that involves implementing policy reforms, investments in education, and support for healthcare workers can effectively address the shortage and help ensure that Americans are getting the care they need.